Hi students, so today we are going to learn about Form 4 Science. The chapter is about Chapter 2 Emergency Help. So this is one of my favorite chapter because I am a St. John. I don't know that whether you are a St. John member. When I was in Form 4 and Form 5, I really enjoy being as a St. John members. And even though I am not the high rank officer, but I still enjoy emergency help even until now because we never know that when we really need it. I think there will come in a time that this chapter is not that we want to learn we just because we want to score marks, but we want to learn this chapter so that um, I mean you are going to live at least until 70, 80 years old or 90 years old, right? Surely in the future there will be one time you need emergency help, and that your one time maybe you are saving life. So I want you to take a mindset to study this not just for exam, but in the future you might save some life, and it might be your loved one, it could be your children joking, it could be your wife, it could be your husband, it could be your grandfather. So yep, not just for exam, but we learn this for the benefit of other people. And it's so difficult to teach this chapter in books, but it needs practical thing. Okay, so let's start up with CPR. Everyone know what is CPR, right? The CPR stands for what? Cardiopulmonary resuscitation. So cardiopulmonary referring to your heart. Resuscitation means to revive someone. Like if you are dead or going to die, we want to revive the person. Usually we do CPR because the person is not breathing, correct or not? It's not breathing, there's no pulse. No breathing, no pulse means you're going to die very fast because there's no oxygen that going to your brain, there's no oxygen that's going to your body, and your body is starting to die. Depend on your sickness. Nowadays in the hospital is very high tech, that when you die they already calculate, they have 12% of bringing you to survive depending on what cancer you have, what sickness you have. Some is 12, some is 40, some is 8 and 5, I don't know. This is the hospital thing, and it's very high tech nowadays. So not only that, now they want like they have the agreement like whether you want to stay alive or not. Whether that's the problem, like when you go to hospital and you are going to die, whether you want the doctor put tube into your lung to let you alive, but if let you alive then you just sit on the bed, then what's the point of just sitting on the bed? Maybe to die is better. So this is the ethical thing that the hospital that is facing. But today we are going to learn CPR. Sorry, diverse, but we already divert to other topic. So yes, knowledge is emergency help is very essential. You never know when you need it. Even in a restaurant, let's say you see a baby choking, that's the time that they need you. If not, we don't want any baby to die, right? We don't know anytime anything might happen. Like the Malay proverb say, malang tidak berbau. Correct or not? Bad thing happen, you got smell or not? You never have the smell. Something happen, bad happen, it just happen. So the procedure of cardiopulmonary resuscitation. Before we learn the procedure, I think we must learn why we should do it first. Here we got why we must do it first. First, to assist the heart to pump blood in the body and to allow the air to flow through. So, in the basic term, when you stop breathing, you meet an accident. The person is not breathing. There is no pulse. You want to do CPR. Why? Because you blow. When we breathe in, there's 20% of oxygen. When we breathe out, I think they are like 16% oxygen. So when we breathe in, breathe out, there are 16% of oxygen left. So we want to blow in one time, two times. So oxygen go into their lung. Continue to do compression because our heartbeat beat, right? When we beat, what happened? The blood pump to our head, pump to our body. So we compress so that the heart can press. So the blood continue to go. Even it's very slow, at least something is moving in your blood. After that, repeat the process, blow. oxygen go back to the lung. Compress, 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 compress. You are going to do this for 15 minutes, I guess, until the ambulance arrive. But usually if you do like that also cannot breathe, usually the person will die. But you still need to do something, right? Rather than you just look and see. You never know. Even 0.5% to save the person, we must take the chances of 0.5%. So, okay, so these are the procedure you need to remember. DRCAB. So what does this mean? DRCAB. Oh, so before I continue this book notes, I take from Oxford. So this is not my notes, this is the Oxford note. I don't want to take credit for it. I want to give back the credit to Oxford Fajar. Okay, so for CPR, you want to conduct CPR because there's no breathing. No breathing is easier to see because you just need to look and hear whether there's a breathing sound. Look at the chest, correct or not? The person is lying like that. You look like that. Take the head, look like that. So your eye look at the chest, see whether go up and down. You want to hear whether there's a breathing sound, and you want to check got pulse or not. You really need to learn to check for pulse. Seriously, this is really important. As I said before, don't take this topic as exam come out, you might save life. Try to press here, see yourself whether you can check a pulse. Let me see. Yep, I can feel it. Because I'm a science teacher, I will ask students, please continue to press. If you cannot find, you press until you can find. Relax, calm down, make sure the room got no noise, concentrate until you find. Now I can find it already because I get used to it. Not only I can get used to it, I can straight away like touch your neck and I know where's your pulse. Practice it. See your brother, ask your mother, ask your father, come and can I borrow your body? I want to practice to test whether you got pulse or not. Continue to learn, okay? 2 finger, put on the what? You can see, you can count, tutup, like that. I gotta check the pulse. So first, what are the procedure that we want to do? There's no breathing, there's no pulse. First thing you need to do is de-danger. Examine the surrounding, make sure the victim has a safe surrounding, correct or not? Before something happen like this, we want to make sure the place is safe. For example, let's say the place is not safe, maybe like, I don't know, maybe it's a highway and at the right lane of the car, at the right lane, or at the junction that there's a blind spot, maybe a car will come. Usually people say, oh, now he fall down accident already, don't move his body. It depends. If the place is too dangerous, maybe you want to move it to somewhere safer first, like beside the road properly, okay? If there is no danger, you can divert the traffic, then maybe you should divert the traffic. That time it comes to your logical thinking and your rational and your critical thinking. Now it's really your critical training. The K5 question. You should move or you shouldn't move. Okay, you calculate the risk by yourself. Okay, so you go there and you say, can you hear me? Usually there is no response if you want to do CPR lah. If the person got response, then you don't do CPR lah. Unless the girl very pretty, you want to kiss, is it? If not, you just okay. Hello sir, Mr. Hello, can you hear me? Are you still there? Hello. Continue to shake him. No response. Find people beside you. Hello sir, can you help me please? Can you help me to call 999? If you know 999, you straight away use your phone 999 loudspeaker like that, okay? So you call 999, the danger. After that, you call 999 and you want to check. After you call the 999, you check the breathing and the pulse because there's no response. So there's a danger. You check whether the place got danger or not. After that, you want to ask the person, hello, got response or not? Then followed by compression, airway, and breathing. Check breathing and pulse. If the victim is not breathing or no pulse, administer CPR. No breathing, no pulse, do CPR. But call 999 is important. Almost every 2 years, I will call 999 because I drive car, I will always see accident And now I call 999, I'm very, because I think I call 999 3 times already. I'm very straightforward to the answer. Before they ask me, I know how to answer. I will say 999. They will tell me I'm my name is Billy. They'll straight away tell you, are you Mr. Billy? Say very details. I saw an accident from a two motorists from the Jalan Hang Tua at the direction from a mosque to a petrol station at Shell. This situation probably need one ambulance. Straight away like that. I give a very clear direction to the ambulance. Don't when you call, ask you where, I also don't know where am I. No, you think of the landmark, think of the jalan, say from which direction to what direction, and then you can help the ambulance to come fast. You don't want the ambulance to suicide, right? Every second matter because you want to save life. So after that, 3 main steps of CPR is compression, airway, and breathing. No response, no pulse. So what are you going to do? Lay the victim on the bed, lie in the surface. So lay back. I think maybe you can ask your brother or sister to come and try. Let's try. I think it's fun. I'm a St. John member. I got a door to practice, but I hope that you can use this time to go to YouTube later on. Just YouTube how to administer CPR and how to practice. I think you need practice. This is important. So, kneel to the side of the palm and one hand at the sternum. So, where is it? So, the sternum is at here, right? Here, you press up your bone. Press until here. There's a bone here. 2 fingers here. Then you put your palm at here. Then you can start to press. Of course, you cannot do to yourself. Even just now I do very difficult to myself. But you need to do at other people only can. So, if your brother is naughty, that's the time you need to teach your brother a lesson. Yeah. So grab the hand, interlocking hand, put the hand like that. Check the bone, sternum up, as seen in the picture. Put 2 fingers. Put your like this. Hold like this. 1, 2, 3, 4, 5, 6. So around. Put your sternum, interlocking figure 3 to 5 cm. That's why I say 2 finger, right? Or maybe you can put 3 finger if you want to. For as many as 60 times, 30 times at the rate of 100 compression per minute. So you don't need until count 100 compression per minute. Just count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Do until 30 times. During this emergency time, you will be panicked, but this is seriously not the time to be panicked because we want to save life. So the brain cell will stop to function if the heart stop breathing for 5 minutes. Unless you want the person to die faster, you just look at watch. Just look at take picture, put at Facebook, going to die, yeah. Let's put at Facebook. Oh, I see an accident, he's going to die soon. Or you are going to be someone different that really at least call ambulance first. That's the first step. At least call ambulance first. Compression aim for the maintain blood circulation. So you press 30 times. Oxygen be supplied back to the body. We want to supply oxygen. Not only compression, there's no oxygen in the body. So we need to blow. Blow. Airway. How to put airway? First, you need to, I see here or not, here is this at here, okay, the breathing. So what you want to do is, you want to pinch the nose, cubit, pinch, cubit the nose. Then, like this finger, can see or not, the finger press the nose. This one lift the chin up. So here say, lift the chin up and then you blow. So when you blow, usually you'll see the chest go up a little bit. you blow harder a bit lah, don't blow soft. This is you want to save life, you know, it's not play. We want to be serious. So we want to 30 chest compression and 2 breath. 1, 2, 3, 4, 29, 30. Blow. 1, 2 times. Okay, continue again. Do until you for the ambulance to survive. It's somebody's children's life. But I never made before accident. But I called ambulance many times. Luckily, I never administer CPR before. So, yeah, this one you already learn right, like from nose to the mouth, human breathing. After that, we already learn to the trachea, bronchus, bronchial, alveolus. This is something new. How to pronounce this? So this will be called as pharynx, and this one will be called as larynx. Okay. So from mouth to pharynx to larynx to trachea to bronchus to bronchial to alveolus. You might want to remember this. As you know, Form 2, they ask you to write down. Form 4 also exam that might come out for exam. So I will just put a star at here. Maybe it will come out in exam. Okay, let's move on. Okay, so this one, if you still remember, Form 2, we already learned, right? Form 2 or Form 3, I think it's Form 3. This is about breathing, inhalation and exhalation. So you already know, right? Inhalation, exhalation. For inhalation, the rib move upward. For exhalation, the rib move downwards. So this one you can read by yourself. Our air contains around 20% of oxygen, 21%. Some books say 20%. It's some similar to that. Correct, not chemistry experiment. You still remember, you burn it, the water goes up. So it will go up to 1/5, showing that there are 20% of oxygen in our air. For the experiment, it's 21%. After that, you are going to continue to do it. This is the next lesson. So we already learned CPR. Okay, CPR is something like that. I hope after you watch this video, you will how to say you will press how to do CPR. So I want you to learn how to do CPR. Recovery position. We want to learn what is recovery position. So we want to recover the position because you know recover and position and resume normal breathing. Let's say the person is breathing. He continued to breathe already. So what you want to do is you want to do recovery position. So this position allows the air to enter the lung and prevent the airway from being obstructed. Do not carry the procedure if the patient suspects spinal injury or other trauma. So you want to do recovery position because they say that when I was learning in St. John, they say that if you like that sleep, since the person is unconscious, the thing will go down your tongue or your other thing will obstruct the airway. So the person start to cannot breathe because your tongue fall down or other thing fall down. I don't know, something like that. So what I remember is the tongue. Okay. So first, place the person hand on the chin like this. After that, move it down, bend the knee to 90 degree, and he used the hand as the pillow. So by doing like this, the head like that, so the thing won't go into the mouth and block the mouth. It will just, let's say the person tongue is coming out because he's too tired. So his tongue will be like that. The tongue won't go inside, right? Because you already put a pillow for him. The head is like looking down onto the road of the floor. So this is a recovery position. I think it's like a similar position to sleep, right? If you sleep on something, this is a good way. After I learned this, I like to sleep like this. I mean, like, yeah, I put my pillow here and the leg I put up a bit, use a bolster. I feel that it's more comfortable. I don't know, you can try to sleep in recovery position. I also hope after you watch CPR, if you are like science, I hope you can search how to conduct recovery position. So you also can learn this recovery position. Okay, so what is this? The defibrillator is a device that supply high electric shock to the heart to return the heartbeat to normal. Automated emergency defibrillator AED can easily be used of the public by following the instruction. So yep, this thing lah, like the hospital thing, right? So when they do like the electric shock, it will pump the heart so that the heart will go back to its normal state. Okay, so it's really nice to nowadays. It's really advanced. From die sometimes, not every time. It's sometimes really the hospital can bring you back to life. But the question is whether you want to come back to life or not. If you just come back to life just to sleep on the bed, it's a very debatable topic, right? Whether you want to be like that or not. For me, I think better let me sleep lah. Don't put the pipe for me and let me sleep on the bed and then die in the next 10 years. Okay, why is it important for each one to have to take initiative to learn emergency help procedure? Okay, so the answer for this question is I'm going to make this on the other video because now is 12:30 and I'm feeling very sleepy and I want to go to sleep. So I will teach this in the next episode. So what you can help is to support this channel. Remember to click like and subscribe so that it can help me really. It help me even you just press like and subscribe. So thank you very much. If you have anything you want to ask, you can leave it at the comment below. See you next time. Bye bye.